My name is Dr. Eric Westman, and I'm an assistant professor of medicine at Duke University Medical Center in Durham, North Carolina, in the United States. And I've been studying the effects of low carbohydrate diets on health, obesity, diabetes, for about the last 15 years. Several years ago, I think it was about 1998, a few of my patients came to me on a strange diet, but they had lost a lot of weight. And I was an internal medicine specialist at the time, and I was curious to ask what they had done. And two of my patients in a row lost weight using a low carbohydrate, high fat diet known as the Atkins diet at that time. And at first I was against it because I didn't know much about it, and then I was worried that the cholesterol levels would get worse in their blood because they're eating so much fat. But two in a row of my patients, I checked their cholesterol and it was actually fine. It actually looked good. So I was in a clinical research training program at the time and searched around and found a doctor who had been doing the diet for 30 years. It was Dr. Atkins. And I went to visit his clinic to learn about it, and then went back to Duke University to do research on it. The prior study was published in 1980. So there hadn't been a study on this type of high-fat diet for over 20 years. So our group and another group in the US were the ones to approach Dr. Atkins, who was a clinical user of the diet, to formalize and to really study the diet really carefully to know that it would be a healthy thing to do. Over the last 8 years, I've been using the low-carb, high-fat diet in my own clinical practice at Duke University within the private university practice. So I have a lot of clinical experience now using this kind of low-carb, high-fat diet for obesity, for diabetes, for metabolic syndrome, high blood pressure, heartburn. Many things get better. So I found it to be a very effective therapeutic tool for a lot of the medical conditions that I used to treat with medications as an internal medicine specialist. When we first presented our research around 2002, there was quite a bit of backlash about the study, and I honestly went into the studies not knowing how controversial it would be. The effects that I saw were positive, and we followed the positive data, and that's based on the research over the last 15 years that we and other people have done around the world. My lecture today was low-carb, high-fat diets and the treatment of obesity and metabolic syndrome. So obesity is in epidemic proportions in the US and other Western countries. It also is one of the root causes of the metabolic syndrome, which is now thought of as the cause for heart disease and atherosclerosis.